This video will demonstrate how to clean the tracheostoma and change the trach tube ties. Trach care is the cleaning of the neck and tracheostoma and should be done twice daily, but can be done more often if the area becomes soiled or moist due to drooling, food, vomit, sweating, etc. It is important to keep the skin clean and dry to prevent skin breakdown and infection. To begin, gather all necessary supplies: clean water, mild soap and water, cotton swabs. In the hospital, these will be sterile, but at home it can be Q-tip or other brand, washcloth or gauze, scissors to cut ties or dressing to fit the child, absorbent dressing if using a dressing. Clean gloves. Clean gloves are optional for parents, but should be worn by all healthcare workers. Clean trach ties. Make sure to inspect it to make sure the Velcro is working and the tie is intact with no stiff or hard edges. Emergency equipment. Have emergency equipment easily accessible in case of decannulation or any other emergency issues. This includes downsized trach tube, ambu bag with oxygen, and suction. We do recommend having a second trained caregiver to hold the trach tube. Start by washing your hands. Put on gloves if you are using them. Prepare your child by placing him or her in a position of comfort. Place a roll, such as a towel, under the shoulders if needed to help visualize the neck and stoma site. You may also want to swaddle your infant or young child to prevent extreme movement and grabbing of equipment. The second person holds the trach tube in place at the flanges of the trach tube to prevent the trach tube from coming out. Remove the tie from one side. Then remove the dressing, if used, from under the trach tube and inspect the stoma for any signs of skin breakdown or infection, rash, redness, odor, or drainage. If you notice any signs of infection, please contact your healthcare provider. The skin on the neck under the ties and around the stoma should be the same color as the rest of their skin, and the stoma should be pink like the tissue inside of your child's mouth. Next, use a cotton swab dipped in soapy water and clean the stoma, starting at the top and moving outward. Discard and get a new swab and continue to do this until all the skin around the stoma has been cleaned. Then, with a cotton swab dipped in water only, clean the stoma. Again, start at the top and move outward. We will use sterile water in the hospital, but you will not use sterile water at home. Remember to wipe the flanges or wings of the trach tube as well. Use dry cotton swabs to dry the stoma site using the same procedure. You can also use a dry gauze or a cloth. Next, clean the neck with mild soap and water using a washcloth or gauze. Dry the neck with a towel or gauze. Again, inspect the skin for any breakdown or signs of infection, rash, redness, or drainage. Place the absorbent dressing around the stoma and under the flanges of the trach tube. If cutting a dressing, make sure that it fits just under the chin and does not flop over or occlude the trach tube. You will cut a single slit that goes about halfway down. These dressings wick away moisture from the stoma site and surrounding area. Attach the clean trach tie to the empty wing. Remove the old trach tie and bring the new one around the neck and attach it to the other side to secure. Make sure the trach tie is securely attached to both wings, but not too tight around your child's neck. To ensure proper fit, you can sit the child up while the second caregiver holds the trach tube in place. You should be able to fit one finger between the trach tie and the back of your child's neck, or 1 to 2 fingers for older children and adults. Adjust the ties as necessary for the proper fit. Remove swaddling and towel roll if used. Remember to apply lotions and creams only as directed by your child's healthcare provider. While you may not get a new trach tie for each day, you can wash the trach tie in warm soapy water and allow it to dry for later use.